pleased to see, again, so many people associated with making this package available. We've just been dealing with a package having to deal with aging, growing older, and aging issues, and of course related to that is health planning and health-related bills. There's going to be 7 bills signed today. Many of you have been associated with all of them, some more particularly with some, and would be happy at the end of the signing to take pictures with everybody to commemorate the good work that's been done. Let me just summarize for those who may not be, or may be here for 1 or 2 bills and not familiar with everything we're doing today, what it is that the package involves and why we put them together this way. This 1616 is relating to the State Planning Act's objectives and policies with regard to addressing issues concerning Native Hawaiians and eliminating health disparities. Health disparities is a rather benign term for some of the very, very challenging issues that we have in terms of diseases and the preponderance of health-related issues in different segments of our diverse society, particularly where Native Hawaiians are concerned. And I think that this update will not only clarify that, but give special emphasis where it's needed at this point in our history. 1723, which has particular importance for Representative Nishimoto, amends the notice requirements with regard to involuntary patient committed pursuing to legal proceedings involving fitness and family court time to conduct a timely hearing and termination of the commitment order. As a former probation officer, I can tell you that this is crucial to both preserving the question arising as to what people's rights are, but at the same time indicating what the public interest is with regard to any individual assessment where you are talking about the commitment of someone into a facility, especially on an involuntary basis. They may not be capable of understanding what the danger is both to themselves and to others. This is a very timely bill as a result, particularly in cases now where we have populations that are increasingly finding difficulty with regard to addiction, with regard to mental illness. This is unfortunately a necessity at this time, and the fact that the legislature, with Representative Nishimoto's leadership, recognized it, I think, is very important. 2320. This is the health equity bill that requires us to, especially in relation to the previous bill, to utilize what we call social determinants of health in assessing health needs in the state. This was the purview and the passion of Loretta Fuddy, and I'm hoping that in time to come, starting now, that we can all agree that we should call this Loretta's bill, or Loretta's law, once it's signed. And the social determinants comes from her commitment and her lifelong focus on particularly where children are concerned and children's health, and what was in her mind clearly represented in the challenges that those children had to meet, and in her role as the Director of the Department of Health, that the social context is as important, if not more important, than diagnosis and the physical side of things. The physical side of things may be the result, and if we could get early on into the social factors associated with health care, that we might be able to get into a preventative context far more fruitful and far more pertinent to the question of the delivery of health care. So that's 2320, Loretta's law. And then 2581, this is the Innovation Waiver Task Force with regard to the Affordable CARE Act, we have the opportunity to ask for a waiver and to move forward on a waiver in the context of the 1974 Prepaid Health Care Act and the other progressive elements of our insurance, healthcare insurance program that has evolved over since 1974. So this gives us the opportunity to move forward in that in a productive way as we tackle the question nationally of delivering health care and relating it then to the Hawaiian context. And then 2469 relating to telehealth. I know Beth Giesting is particularly interested in this, and you'll notice that we're changing what was a phrase of art, if you will, in its time, telemedicine, which in today's context, particularly with our capacity for, in this digital age, in this internet age, in this cyber age, telemedicine is too restricting a way of regarding telehealth. And if we take telehealth, it's comprehensive, it's inclusive, and this provides for equivalent reimbursement for services, because I think we all agree, particularly in our island context, that telehealth is going to be more and more a key element, if not a central element, in the delivery, not just of diagnostic, but of treatment follow-through. So this is very, very important bill. I have no doubt it'll need amendments in time to come, but I think this establishes the foundation. It's a clear path. I think it's very, very important. Then 2400, again, Representative Nishimoto was a key element in this, providing for temporary disability benefits to employees who suffer disabilities as a result of donating organs. Now, again, this may have been an esoteric consideration in years past. I can remember myself talking with Sister Maureen Kelleher years ago, decades ago, with regard to St. Francis and organ donations that at that time was kind of pioneering in that, but it was a rare occurrence, and rare because it was unique and innovative and very, very fraught with all kinds of possible consequences that the full measure of which we didn't have a good handle on, either technologically or diagnostically or in post-operative treatment. That has changed considerably over time, and so the instance of organ donation, and it's, I won't say it's commonplace by any means, but it's certainly not in that category of the exotic any longer. And so this bill is a direct reflection that the numbers are changing on this, and with the numbers, the requirements for our society to reflect what's necessary in order to facilitate the happy consequence of an organ donation, which obviously goes to more than just the person receiving it. And so again, thanks to that. And then 1233, Senator Wakai has recognized this side of it. This has to do with employers, allowing employees to take leaves of absence when it comes to organ donations, stem cell donations, unused sick leave, etc. It gives a clear path of understanding for employees and employers who become involved in this very traumatic issue, medical issue. Each one has its own story. Each instance has its own dynamics. And therefore, this legislation is very, very pertinent because it gives us a foundation to consider each instance contextually, and at the same time provide a standard foundation as to what benefits are and what is expected both of the employee and the employer. So I believe that as a group, this group of bills, this real helps the Department of Health to realize It's healthy communities, healthy people, and healthy islands vision. And I'm particularly pleased that 2320 passed. I know that Loretta's passion will be memorialized in this statute, and I'm pleased about that. So, I think that gives us the opportunity to move forward with this. And I'll bring the bills up. And inasmuch as they all passed, obviously without the legislative help, it wouldn't have happened. Senator Potter could come up and flank me here while I do the signing of all of those. And then we'll take pictures with individual bills or all together, and as it suits you, and your particular interest or general interest. First is this is the health planning one. I know there's a particular interest. I know that the Office of Hawaiian Affairs was instrumental in helping to put this together. Don? And 1723, Representative Mishimoto, of course, is interested in this one. That's done. Whoops. Different pens, but I'm using the same one. And 2320, this is Loretta's law. And then 2581, this is the waiver authorization. Telehealth. $2,400. Temporary disability benefits. Representative. On a leave of absence.
Today.
There we are. That's good. Congratulations. Very good. So yes, take photos with the representatives first. Well, let's take photos with the reps first, and Glenn. You get to pick a bill.
Like two babies.
Yes, you got
Twins.
You want to hold them both? I'll hold one and you hold the other. That only makes three. How's that? Okay. Put that over there. Okay. Here we go. The one I have is well, I got your bill. I got yours. It's 2,400, right? Yeah, there we are. And I've got 1233.
Oh, this is.
Okay. Very good. Pleasure. Congratulations.